So in the interest of time, good afternoon, good morning for those joining us from different time zone, and welcome to this session on strengthening the statistical production process. My name is Scholastica Kingi from Kenya National Bureau of Statistics, and I'll be your moderator for this session. We have an excellent lineup of presenters this last session. You know, you reserve the best for the last. So I will briefly introduce each of our speakers before their presentation, and each presenter will have 10 minutes of presentation, and if time allows, we'll give them 5 minutes of questions and answer, and it's 5 minutes max. So my assistant will be helping us with the time on my left. So if time will not allow us, I kindly ask the participants to hold your questions, and then we'll have a last session on Q&A. Please note the questions down along the way. So before we begin, let me ask a quick questions to our audience. By a show of hands, how many of us has ever dealt with either missing, delayed, or inconsistent data? When missing, delayed, inconsistent data. So then we are all definitely in the right session. So we are going to see how different countries are tackling all these angles of data. And with that, let us begin. So our first presenter, who is Alfina Farsian from the Statistics Indonesia, will be presenting a paper on what does it cost to achieve timely and complete vital statistics. And she has a proposed financing model for strengthening the CRVS in Indonesia. Alfina is a statistician with over 17 years of experience. This is where you clap. In statistics. Indonesia, specializing in population statistics, data collection system modernization, and strategic partnerships. She leads CRVS development through Indonesia's vital statistics system, a key national reform to enable more timely and reliable vital statistics. Her work focuses on transforming fragmented data systems into integrated policy-relevant population data infrastructure, including supporting the transition towards a register-based population census. Alfina, if you can just wave so that everyone... Thank you. Then our next speaker will be Dr. Stephen Chanda from Zambia National Public Health Institute, and he'll be discussing the evaluation of the viability of verbal autopsy-based mortality bulletin as a complementary source of vital statistics in Zambia's CRVS ecosystem. Daktari is an epidemiologist at the Zambia National Public Health Institute and national coordinator for the Zambia sample-based registration system. A clinician and a public health professional, he specializes in mortality surveillance and health system strengthening. He is currently pursuing a PhD on innovative approaches to cause of death determination and CRVS strengthening to improve mortality data quality and use. That is where we clap as he waves. Then our third speaker will be Mr. Nimdinu Maya from the Ministry of Health, Sri Lanka. He's a medical officer in health informatics at the ministry and serves as the country coordinator for the Data for Health, Civil Registration, and Vital Statistics Improvement Program. His work focuses on strengthening mortality data system, including the development of implementation of Sri Lanka's monitoring and evaluation system for mortality statistics. He has also contributed to improving the MCCD through training and curriculum development. His research explores how digital CRVS innovations can enhance the quality and use of data, mortality data for evidence-based public health policy. Maya will be presenting on enhancing mortality data in Sri Lanka, evaluating the effectiveness of a digital monitoring and evaluation system for CRVS. Then the fourth speaker is Mr. Ignatius Sandi from Statistics Indonesia, who will be talking about improving data validity in vital statistics using civil registration data. Ignatius, or Sandi will be easier, is an IT specialist at the Directorate of Information Statistics, Statistics Indonesia. He has been involved in the Civil Registration and Vital Statistics Initiative at the Statistics Indonesia since 2020, starting with the 2020 population census team. His main area of work in CRVS focuses on data integration and development of web-based dissemination system for Indonesia CRVS data. Currently, he's on study leave pursuing a Master of Information Technology with a specialization in cybersecurity at the University of Melbourne. His research interests focus on data privacy and blockchain. He will present improving data validity in censuses and surveys microdata using civil registration data, which highlights lessons learned from Statistics Indonesian experience to improve the quality of census and survey microdata as impact of CRVS. Yes, and last but not least, our final presenter will be Mr. Valence Kagisha from Vital Strategies. He'll be presenting on how prepared is Rwanda's CRVS system to generate data for SDG 16.9. Mr. Valence is a statistician and a mortality data analyst with Vital Strategies Rwanda, a member of the Rwanda CRVS technical team with 6 years experience in disease and mortality surveillance, currently focusing on strengthening CRVS and verbal autopsy system. So that is the lineup for, yes, that's the lineup for our presenters, and I'd like to invite our first presenter, who is Alfina, and over to you. Thank you.
Thank you, Scholastica, for your kind introduction to us and makes people clap for us. So I think we should clap also to Scholastica, for the representation. Once again, my name is Alvina from BPS Statistics Indonesia. So I'm coming from governments. We already heard and deliver and talking about gaps, evidence, and problems, issues that sometimes can be perceived as offensive or uncomfortable criticisms rather than supportive. But we know that we don't want to criticism, but give a support to our government. So today, I would like to take a different approach of strengthening CRVS to costing perspectives. So because with the current financing approach, it is very difficult to expect a big or significant change. So I bring a proposal to us to discuss what it takes, what it costs, and what we can gain, and more importantly, what are the impact or the benefit that we can unlock. So let me start with the Indonesian context. So CRVS exists in Indonesia. So it collects data, is register events, is register people. So CRVS, or the systems, we call it SIAC, it serves more than 285 million people. So it's one of the largest system in the world. So it's registered around 2.5 million births, around 1 million deaths every year to be registered in these systems. But in practice, these systems are still fragmented. We talk about fragmented in this forum, so it also in CRVS in Indonesia. Health systems, civil registration, and statistical system is not yet fully connected. So many events are still registered late or not registered at all. So many deaths that not registered in the systems are still in the system, so there is zombie deaths. And now, for now, we have vital statistics report, but only published in 2024. That's the first and hopefully not the last. So because of that, we don't have, or there is limited evidence on how much investments is required to strengthen the CRVS. So for this time, we need guidance how much investment is needed to improve CRVS. So there is some background why we need this study. And why now? Because Indonesia now at a very important moment. A new regulation on vital statistics is currently being prepared and is expected to be enacted this year. So this regulation, the objective of the regulation is reach agreement on this framework, as in the picture. It's a busy framework, busy picture, but the main idea of this framework is to move toward fully interoperability, so that vital events are registered on time, and then the services become more seamless. Data sharing across institutions in safe way will be agree in this framework, and also at the end, Indonesia can have vital statistics can be produced every year. So this is a window opportunity for policy alignment and also to secure financings. So the next question is how to estimate the cost of the strengthening CRVS. So we use ABC, or activity-based costing, aligned with the GSBPM, Generic Statistics Business Model. So we map all the activity and then quantify the cost. And then to better link the finding that we have been discussed in this forum and also in Indonesia, we further group the cost domain into 4 areas. First, policy and institutional alignment, because without policy, without legal framework and so on, it's hard to make every partner, every stakeholder work together. And then the third is IT system and infrastructure. So we want to build full interoperability. It will be side to side with the capacity strengthening of the human resource. And the last is about completeness improvement. It is something that we call outreach. So this is the idea or the cost domain. What it costs to the strengthening of CRVS. I want to talk about the completeness improvement here. This is about outreach or reaching the events that maybe the IT cannot reach. It is because in Indonesia, around 20% of birth and 60% of death is occur outside health facilities. So this is the cost that we are estimate. So the total investment is around 3.1 trillion rupiah, or approximately $200 million between 2026 to 2030. So this number may sound large, but later I will show that this is actually reasonable. It's also important to clarify that this is incremental costs. So this is not a routine operational budget. So now let's look closer. Almost 44% of the investment goes to improving completeness. It is to reach out birth and deaths that occur outside health facility, like I mentioned earlier. And then another 30% goes to the IT system and infrastructure. It is to enable full end-to-end interoperability, including marriage and divorce registration. So for the improvement completeness or the outreach only for birth and death, and it's not including marriage and divorce, but for the IT system is for all registrations. I would not say that this is not a permanent cost, but this is a front-loaded investments. Higher at beginning, once system works, the cost of maintaining it become much lower. So next, what can this investment deliver? So first, the pattern of registration in Indonesia Maybe all of you already heard in this forum that around 50 persons that are registered in the same year when they occur. So like death, like a birth, it can take to 5 years to get fully registrations. And then for the death, completeness remain around 60% even after many years. So this investment is designed to change that patterns. So by accelerating timely registrations. So between 2026 and 2030, we estimate in total almost 15 million additional record registered on time with these investments. And the cost for registration is around $12 per registration, which is very close with the global average from World Bank. Is around $13. So based on this costing model, we estimate very significant improvement, and then we project by 2030, we are achieving full registration. Now, beyond the improving registration, this investment also strengthens the statistic systems. So we can see here, CRVS can produce more variable, more indicator, more frequent data, moving from periodic data to near real-time informations, because we need the real-time information or data when we have experience in the COVID-19. So it's allow better disaggregation down to the local level. While I will emphasize census and survey remain important, but we also have to acknowledge that they are limited by time and frequency. And by this study, what we can do are the government, the team of CRVS Indonesia, based on this finding, will advocate our government, especially Ministry of Finance, to allocate dedicated financing of CRVS under the new regulation to ensure legal identity, to connect services across sector, improving efficiency, and of course to produce vital statistics. And based on this finding, we have to prioritize investment in completeness improvement for that registration, because 60% that happen outside facilities, and then system registration for birth registrations. This research is has limitations, so many future works can do after this research. And this is the research behind the research, so I would like to special thanks, especially for CRVS CARD teams that make this finding, this study can be presented today. So that's from my study. Happy to take answer and question.
Thank you very much, Alfina. You're right on time. So we have about 5 minutes to take 1 or 2 questions from the audience. And for those who are online, feel free to type your questions in the chat box. So we have 1 and 2. Let me just cap it at the 2 for now, and then the rest we can write it down.
Okay, merci pour.
Thank you very much for this great presentation. Very interesting. I want to know, concerning the cost that you've given us, we know that to raise this money could be difficult in certain countries. So how has this cost been prioritized, or in terms of political recommendations, can we say that this budget, we're talking about large budget, but these are prioritized actions that we can take to start the implementation phase? Thank you.
Thank you for that question. So how do we prioritize the cost, and which activity that we have to give it the cost first? So based on the findings, if we want to have debt registration at the first, it's very prioritized to the governments. So I will suggest to give the cost for the outreach for debt registrations. But for now, the movement is Indonesia is to build interoperability system because this is something that will have impact more, not only for the registers, but not only for the vital events register, but only others government services. So this is something that already in place, already in discuss, and there is so many pilot in IT, and there is some framework, there is some pilot and exercise to make sure all the IT system is work and interoperable and connected between across institutions. So because it's already in place, I would suggest to governments how is the model of the outreach. So this is what the study is just give the idea how much cost that the impact or the gain that we can achieve in 2030 is, let's say, universal, nearly 100 of debt registration and birth registrations. And this is reasonable. And with this kind of number, it's reasonable. So, and when I know the budget of governments, so this is some. Maybe we need more than this number, but this is like an idea that it can be achieved with this money. So for now, our team want to advocate about outreach because IT interoperable is already in place and already something that moving in Indonesia.
Thank you very much, Alfina. And to the last question for now.
Hi, my name is Sabine Wulmi. I'm from Nationality for All, which is an organization that works on citizenship and statelessness. So my concern, I guess, again, with CRVS systems that are being increasingly digitized is whether this would exclude certain marginalized groups. So I wanted to ask, in the cost calculation, does it also include certain measures to provide maybe assistance to groups who may not have the digital access? Mm-hmm. And would there be sort of more safeguards to include them as well? And if I could also ask, when you talked about interoperability as well, so to make a system more interoperable, there's also concerns about user consent as well, right? Whether consent will be taken from people when data is being shared across different platforms. So does the new regulation kind of maybe address that as well?
Thank you. That's a very nice question. So I will ask the first question about hard-reach or marginalized people. Is it including in this cost? Yes, of course. Like I mentioned, there is 4 cost domain. One is improving completeness, which is the idea is outreach. This is the cost that calculated because not all IT can capture all the vital events, because many people in Indonesia still live in the forest, still live in the something that maybe there is no signal. So that's why we have to cost of the for the outreach for these groups. And I would like to say, give the information about this finding is uniform number, uniform of the measure. So it's better for the next study. We have to measure how many costs for the outreach, to outreach the hardest or the marginalized group. But for this study, I just give a uniform that there is so many birth and death that the register not on time, and then I multiply with some amount of the money. But we have to make sure not only one model for the outreach and not one model for the cost. cost of the financings, but this is just an idea. And of course, in the next study, we have to make sure that the model for the artists will be something more special for this to reach these groups. And then the second of the interoperability about the consents. So in Indonesia, we have Act of the Data Protection, Individual Data Protection, and then we discuss whether when the data is for the public service, and then is it allowed to share to the other institutions? There is some limitation if it's for the public services, it's allowed without a consent for the public people, because it will be guarded by the Data Protection Act. So, but if there is, what we have to do, the government to do is to be, to announce whether this data is sharing and what is the protocol sharing from this institution to other institutions. But it's allowed as long as for the public, for statistics, for research, and for the criminal, something like that. So this is stated in our act. Yeah, thank you.
Thank you, Alfina. I think there's a lot we can learn from Alfina. Let's make use of the interaction section over coffee break and also after the session. So I'll quickly rush to the next presenter, who is Dr. Chanda. Welcome.
Thank you very much for the introduction, and good afternoon, everyone. This afternoon, I'll be taking you through my presentation, which covers a strategy that Zambia is currently putting in place to address a critical gap within our CRVS, and that has to do with the availability of timely and scheduled cause of death data. I'll take you through how we are proposing to develop a verbal autopsy-based mortality surveillance bulletin that will act as a critical link between the verbal autopsy practitioners in the country and the several CRVS stakeholders. So as we have seen throughout this three-day forum, is that there's a global gap in death registration practices, and Zambia is actually not an exception. In 2020, only 18% of expected deaths were actually registered. As low as this number is, it actually tells an even scarier scenario in that 80% of the deaths happening in the country go unregistered and without a cause of death. If you see the map there, this shows that the distribution is actually skewed towards underrepresentation in the more rural districts, which collectively have less than 5% of death registration. In Zambia, approximately 42% of all deaths happening are actually happening in the community. So these are deaths that happen away from physicians and would otherwise be not certified in any way. In such settings, the World Health Organization recommends the use of verbal autopsy as a way of assigning causes of death. To this effect, the country has been implementing various VA implementation platforms from as early as 2010, with the largest being the Ministry of Health-led HIV mortality surveillance. Currently, the Zambia National Public Health Institute is currently implementing a nationwide verbal autopsy rollout. But despite this history with verbal autopsy implementation in the country, there's been no structured and scheduled way of providing information on cause of death from the VA practitioners to the CRVS stakeholders who need this information to inform decision making. Notably is that in the 2020 Vital Statistics report, VA cause of death data was actually included from Lusaka district from the Ministries of Health Sentinel HIV surveillance. This was a critical step, and this work that we're currently doing builds on that success. So we are developing a verbal autopsy based bulletin that we then want to assess the acceptability amongst the CRVS stakeholders. Because we've noticed there's a very big gap in terms of understanding, as well as acceptance amongst the CRVS stakeholders. If you look at this graph, this shows how large the problem is that we're currently dealing with regards to death registration completeness. Annually, the country is estimated to have close to 200,000 deaths that are expected to occur. But if you see the two lines below, these actually show the deaths that actually get detected in health facilities as well as in the INRIS. What you notice there is that over 150,000 deaths go unregistered, and with that lack of registration, without any cause of death information. So any strategy that requires understanding of cause of death at national level has to take account deaths happening within the community. To assess acceptability of a verbal autopsy-based bulletin, we adopted a sequential mixed methods study design, essentially in two phases. The first phase, we use available verbal autopsy data to generate a bulletin. In the second phase, we then share this bulletin with the various stakeholders in the country and then use a structured way to measure acceptability using the theoretical framework of acceptability. I'll now talk about the VA analysis. So we use data from one of the largest VA implementation in the country done by the Ministries of Health verbal autopsy surveillance system over one calendar year. Within this system, the 2016 WHO questionnaire was used to capture information, and the inter-VA5 algorithm was used to assign cause-specific mortality fractions. We then mapped these cause-specific mortality fractions to VA major cause categories. So this allowed us to be able to have a better interpretation of the VA causes of death with other existing cause of death data available. It is these VA major cause categories that we then describe by sex, location, and age group. So this illustrates how we did this mapping from, if you look at the figure, on the left, we have the community deaths. So this typically is where a VA would then be done. And then using the algorithm will assign a cause-specific mortality fraction or probable cause of death. If you look at, in this case, malaria. Malaria is then mapped to the larger group, which is infectious and parasitic diseases. And it's these groups that we then describe. Additionally, is that this also presents an opportunity for integration of different mortality data sources. Even information from health facilities, which if you look at the figure on the right, we actually see that the same malaria, if detected in a hospital, because it's under medical supervision, there is additional information that can actually lead to the assigning of a more accurate ICD-10 code. This code can then be mapped to these broad cause categories, and the data can then be analyzed uniformly to give a more harmonized and representative picture about that population. This information then becomes more representative and more policy relevant. If you could please just scan this to have a link to the prototype bulletin that has been developed. Okay. So you should be able to see something like this. So for the sake of this particular presentation, I will focus on the structure of the bulletin and not the actual contents of the VA findings. For those that might be interested to discuss these VA findings, I'm more than willing to meet after this presentation and we can have a more in-depth discussion. So once we had analyzed the data, we needed to figure out how do we package this information in a way that stakeholders can actually make use of this information. So we did a literature search as well as key stakeholder interviews, and a look at various national documents that present cause of death data in the country. And then this informed the development of this bulletin. So this bulletin has 3 pages and has 8 sections. The first is an executive summary, which gives a snapshot of all the contents of this particular bulletin. Then we have a section that talks about place of death, and this would become particularly important as we merge other data sources. We then describe the population that has been captured. On the first page, we also highlight the major cause categories of death by sex. We take a deeper dive into explaining by age and sex the different causes of death. And for instance, here you can see that infectious and parasitic diseases are predominantly affecting the under 5s, whereas cardiac diseases are predominantly affecting the over 65. We also describe these broad death categories by place and by time. Then lastly, we bring back or display the cause-specific mortality fractions by location, to highlight the major cause-specific mortality fractions. So we are able to describe the current VA data and generate a communication product that can be shared with various CRVS stakeholders. But the question still remains about the generalizability of these findings for policy relevance. To address this, the country is currently rolling out a nationwide implementation of verbal autopsy that will be conducted countrywide and will be able to generate not only population representative cause of death data using VA, but will be able to generate other mortality relevant statistics. With regards to next steps, the bulletin has been developed. This bulletin will now be shared with the different stakeholders, and then we'll assess stakeholders' acceptability of this bulletin. I would like to make the following acknowledgements. And thank you very much. For those that may want to reach out, please, that's the QR code to my LinkedIn profile. We can communicate then.
Thank you very much, Zikomo. Stephen, in the interest of time, please just write down the questions that we might have for Stephen. We move to the next presenter. That is Dr. Maya, and Maya will be presenting on the evaluating the effectiveness of a digital monitoring and evaluation system for CRS. Karibu.
Thank you to our dearest moderator. Hi everyone, good afternoon. I'm Dr. Nimdinu Maya Kaduwa. I'm a medical officer in health informatics attached to the Ministry of Health Sri Lanka, and I will be presenting you on enhancing mortality data quality in Sri Lanka by evaluating the effectiveness of a digital monitoring and evaluation system for CRVS. So I'd like to acknowledge this endeavor for all the participants of the Research Registrar General's Department of Sri Lanka, the Ministry of Health Sri Lanka, CRVS Vital Strategies, and the CART Initiative for their continuous support and the guidance throughout this research. And also a special thank goes to Dr. Lakshmi Somatunga, former Additional Secretary Public Health Services, Ministry of Health Sri Lanka, and Dr. Saman Gamage, Senior Technical Advisor, Bloomberg Philanthropies Data for Health Initiative, for their dedicated mentorship and guidance. So mortality data is essential for evidence-based health policy making and planning and monitoring of the national development goals. Actually, Sri Lanka has more than 95% completeness in both birth and death registrations, but the mortality reporting has been basically based on paper-based system, which was aging back in 1867. So the paper workflows resulted in delays in data flow and limited accessibility, and cause of death data quality issues. So the usage of the mortality statistics has its own limitations. So to address these challenges, Sri Lanka introduced a digital monitoring and evaluation (M&E) system in 2023, which integrated with the National E-Population Registry. So my study evaluates the usability, utilization, and impact coverage and the impact of the digital system on the improving mortality data quality. So my study design is mainly quantitative cross-sectional evaluation. The study population consisted of 381 system users who are the data entry officers and additional district registrars of who spread across the 331 divisional secretaries. Out of them, 149 were respondents with a response rate of 39%. And the primary data was collected through the structured user questionnaire distributed among the users. And secondary data was obtained through the M&E system dashboards and mortality data sets of the paper-based system. So the assessment domains were usability through 10 questions. Utilization was assessed by 9 questions and implementation 13 questions, and the coverage of the system by 7 questions, and overall impression by 4 general questions. So the measurement was taken according to the 5-point Likert scale. So score 1 being the lowest and score of 5 means the highest. So analysis was done as a descriptive and analysis was with descriptive statistics and Pearson correlation between district completeness of the system and user perception indicators. So in my results, user evaluation is mainly through the survey responses. There were 149 responses out of 381 system users with a response rate of 39%. And the participants were represented all the provinces of Sri Lanka. So according to user perception scores, the mean score was calculated out of 5. The usability of the system scored 3.55. The utilization is 3.75. Implementation was 3.45. Coverage 3.46 out of 5, and overall impression 3.84 out of 5. So the key feedback of the respondents were the system considered user-friendly and easier than the existing paper workflow, and structured cause of the data entry improved the documentation. And they also noted down some challenges, slow system response and connectivity issues, and limited infrastructure with computer and other connectivity infrastructure in the busy office settings, and the need for refresher training and stronger technical support. The results based on system performance and data completeness, when we consider the national data on 2023, just following the first year of implementation of the M&E system, total number of 181,239 deaths were registered in the paper-based system. Out of that, 65,223 deaths were entered into the M&E system, with a national completeness of 36% in the first year of implementation of the system. And there's a huge variation in the districts. There were some districts showing very high completeness, with in some districts in southern province ranging to 82%. Some districts, one district 70% and another one 60%. But however, some districts showed unfortunately one district showed 0% completeness, and another one 7.8 and another 5.4. So there was a huge variation among the districts. And I applied the correlation analysis with the completeness and the assessment domains I previously mentioned. And there were significant some districts showed significant better user experience and show higher system uptake with the completeness rates. So in my discussion, I would like to discuss that that M&E system represents a major advancement in strengthening the Sri Lanka's CRVS system by introducing the digital monitoring of cause of death Sri Lanka itself. And there's positive user acceptance. Overall perception scores were positive, which means that overall scores were more than 3.4 out of 5 in every aspect. And users valued the structured cause of death entry, clearer documentation, and improved organization compared with the paper-based system. And there are some operational challenges, technical barriers, especially with the local government network, the internet connectivity issues, and slow system performance and session timeouts. And of course, there are resource constraints, limited computer facilities and infrastructure at the office settings. And the capacity needs. The users demanded of refresher trainings and stronger technical support. And the system performance, the district completeness ranged from 0 to 82.8% in some districts, indicating implementation disparities across the districts, which has to be considered seriously. And moderate correlation between usability and overall impression and completeness, suggesting infrastructure and system access plays a larger role rather than user perception alone. So policy implications in Sri Lanka's context. So priority actions should include strengthening infrastructure in low-performing districts, expanding computer access and stable network connectivity, implementing regular refresher training and help desk support, and using dashboards for continuous monitoring of data quality and completeness. So the implications that can be taken up by other countries through this study, I think this Sri Lanka's experience demonstrates that digital M&E platforms can significantly strengthen the CRVS systems, even when built on long-standing paper-based systems. And the successful implementation requires definitely a strong institutional collaboration. That's the main thing you have to be established prior establishing such systems. And user-centered system design and ongoing technical and training support. The users demanded the technical support whenever they needed that otherwise they will be reluctant to use the system, and they will deviate from using the system. So this model can provide valuable lessons for other countries transition to digital monitoring mortality data systems, particularly in low and middle income countries. So recommendations and next steps for this. So to expand research on long-term improvements in mortality data quality and timeliness after full system implementation, and explore integration between health sector systems and civil registration platforms to reduce parallel data entry, and also to conduct periodic national evaluations of CRVS digital systems to guide policy and system improvements. So thank you very much. There are some pictures back at home. Please come to my country and enjoy. Thank you very much.
Thank you, Maya. I think I'll come for the elephants and the waterfalls. So we have about 3 minutes for one burning question. One burning question for Maya. Yes, please go ahead. Thank you.
Yeah, hi Maya, Yandu from Vital Strategies Indonesia. I think from the title of your presentation is focused on effectiveness of the monitoring and evaluation system. Well, I think based on what you presented, it's more into the early adaptations because it's just started in 2023, right? So rather than effectiveness, it's perhaps more focused on the implementations, early implementation stage, and it's not about the system, but more into the supporting infrastructures. I mean, perhaps your monitoring system, evaluation system is already good, but then again, the people cannot use it because of internet, because of the computer and everything. So yeah, that's just my comments on it. Thank you.
Yeah, thank you. Exactly, Riando. That's the problem actually we are facing. It's not that they are not willing to use the system. They continuously gave the feedback that they are ready to use the system, but the infrastructure is the problem. So I have to say that before any country, before established in the system, the basic infrastructure has to be established, and that will help a lot for the sustainability of the system. Yes.
Yeah, 30 seconds.
Yeah, sorry. Another one is in your monitoring and evaluation system, do you also calculate the, is there any changes for the garbage codes or between paper-based and the digital system? Is there any changes in that? So, because that's interesting. Does the garbage code is still there even though it's digitalized? That's interesting for me. Thank you.
Yeah, thank you. Actually, I have in my presentation I have not included the details of the system. You can refer my paper. And anyway, there's a monitoring evaluation of the common errors done by the death declarers, the common errors made by them according to the most common errors done, the University of Melbourne tool. So that was the errors were assessed at the data entry. The coding errors were not yet implemented in the system. Actually, it's in the second phase of the system. It's not implemented yet with the vital statistics unit. But the system is consisting of all the codes, and if it's entered, the codes are entered. But the thing is that to cross-check it, the mechanism is not yet established.
Yeah, and 4 to 5 p.m. at the garden, please ensure we make cues because this is a very rich discussion for everyone. So I'll move to the next presenter, who is Ignatius Sandiwan. Welcome.
Okay, thank you, Scholastica. Good afternoon, everyone. I will present our work titled Improving Data Validity in Censuses and Surveys Microdata Using Civil Registration Data. I slightly changed the title because I think this approach can benefit beyond vital statistics survey related. So before I start, I would like to acknowledge all parties who involved and contribute in this study. First, for the other authors, Yeni Rimawati and Rahmat Ramadan from Statistik Indonesia, the Ministry of Home Affairs, particularly in providing access to personal number identification checker. And we also thanks to Directorate of Population and Labor and Directorate of Statistical Information System of Statistik Indonesia for their support during 2025 Intercensal Population Survey. And also UNECA, Bloomberg Philanthropies, and Vital Strategy who work hard to make this forum happen. So before I go further, I would like explain a bit more background in my country. So in Indonesia, data for vital statistics produced by many ministry, and it is difficult to us to share data each other, especially for data that contain personal identifiable information. So we have to make a MOU between ministry to exchange their data. So in 2019, in a concern to provide CRVS, Indonesia administration issued Presidential Regulation number 62 of 2019 to accelerate CRVS production. This regulation became a foundation of data exchange between Ministry of Home Affairs and Ministry of Health and also Statistics Indonesia itself. Because of this regulation, MOHA can share their snapshot of 2019 population database for entire citizen in Indonesia and also develop web service to check validity of national identification number of citizen. Further, Statistics Indonesia used that population database as a prelude in 2020 population census. Until now, Statistics Indonesia still maintain the data population database in terms of updating those data using current census or survey data. And we also plan use this data for 2030 population census based on registration data. From a collaboration between Statistics Indonesia and MOHA, introduced question, can we use those data to validate respondent response on particular fields such as national identification number, name, date of birth, while survey or census to reduce non-sampling error, specifically on respondent error. And can we use that data as pre-filled for field enumerator by input their national identification number, then other variable from population database can pre-populate in the form, so it make more efficient in the process of collecting data. So we have designed and implemented this kind of system, integrated validation architecture during 2025 intercensal population survey. We use this survey as a case study because this survey have a big amounts of sample, cover all province in Indonesia and all district or cities in Indonesia. We cover like 514 districts in Indonesia. The system architecture consists of 4 main components. The first is KP system itself. It is like an Android-based application used by field enumerator to collect data survey from respondent. In this survey, in this system, they have online mode and also offline mode to support area that uncovered by internet. So in the offline mode, they will store data first in the Android of the field enumerator, and then they can move to area that covered by internet and then send data to the server. The second component is check NIK. NIK is a national identification number in Indonesia. This web service have function to check whether NIK that input by field enumerator is correct or not. This consists of, so in this web service we check data from PPS population database that we have from Ministry of Home Affairs in 2020 population census. And then if we cannot find that data in our population database, further we can check in MOHA that web service. So they can give us notification whether that NIK is correct or not. And the third system is monitoring system, is like a web-based dashboard that allows supervisor to monitor data quality and detect anomaly while survey or census happen. And the third, this is MOHA web service. Behind the check NIK web service, this is provide a verification for NIK provided by Ministry of Home Affairs. This is a flow of our system. So the first stage is on the real-time validation in the KP system, where enumerator receive immediate feedback if inconsistent are detected. And the second stage is a server-side validation in the monitoring system, which analyze data from both online and offline enumeration areas and flag record that required to follow up. The first stage validation starts with a field enumerator record a national identification number from respondent using KP. Then KP will send that number to check NIK web service. And then that web service will result 3 different status. The first is valid, where identification number exists in the civil registration system. Second is invalid, when the number doesn't exist or doesn't follow correct format. So we have like structure format for this number consists of 16 digits. And the third is default NIK, where a respondent don't know or don't have their identification number. Next, for the valid NIK records, additional validation checks are performed to compare gender and date of birth information between survey response and pattern of national identification number. So from our identification number, we can identify where person was born, where were they registered in the first time, and their gender. So after it's implemented, we evaluate its performance. So for performance evaluation, we discovered that unsuccessful hit mainly related to network problem, and we have a 4.8 second latency is above recommendation where should be under 2 seconds, but is still acceptable because we use a asynchronous system to allow field enumerator continue record other data while awaiting result. Performance improvement effort have been done by use divide population database into several databases and hit our infrastructure first before hitting Mohad web service, because Mohad web service serve not only for statistics in Indonesia but serve for all ministry in Indonesia. So other than evaluation on performance, we also evaluate the data validity in our study. So from 1.9 million survey record, about 96% contain valid NIK, while 2.35% were invalid, and almost 0% were flagged as default. Among the valid record, further validation identify 1.93% gender inconsistent and 9.46% date of birth inconsistent. And this is a graph of our validity assessment. So mostly in the Sumatra, Kalimantan, and Java Island, they are valid, while in the Papua, they have more percentage of data invalidity. And for birth inconsistency, we discover slight bit inconsistent pattern also vary in geographically. Similar with invalid NIK, inconsistent date of birth concentrate in Papua, Maluku, and Sulawesi. However, some area in Java and Sumatra also have inconsistent date of birth. And then for the gender, it's quite random rather than invalid NIK and then date of birth. We can see that some areas in Papua have high validity for gender consistency. So for our finding, overall the result demonstrate the near real-time validation using civil registration data is technically feasible and operational effective at national scale. The architecture successfully processed nearly 2 million survey records across all provinces while maintaining strong system reliability. And real-time validation allow field enumerator to correct inconsistent information immediately during the interviews, which represent a major improvement over traditional validation method that occur weeks after data collection. And more broadly, this study show that Administrata integration can strengthen both survey quality and civil registration systems simultaneously while maintaining strict privacy protection. And the last For the recommendation, we have 4 recommendations. First is a sustained institutional coordination. Second, enhance interagency collaboration. And third, privacy and data protection framework, because we interchange sensitive data. And the last is infrastructure investment, because we use ICT in this process. Thank you, and I open for any question from the audience.
Thank you very much, Sandy. Sandy is the first IT person who has literature. Most of them, they hardly speak. So we have about 2 minutes for, I want to see those with questions. My people. Okay. So as you think about the questions to ask, we can do it in the Q&A. So we are moving to our last presenter, that is Valence from Vital Strategies Rwanda. I introduced you before, so you can just do a brief introduction as you proceed. Karibu.
Okay, thank you, moderator, and thank you all for coming here. I'm Valence Ndagijimana, working for Vital Strategies in Rwanda, and I'm going to share with you the findings of my research entitled Aligning Rwanda's Birth Registration System with the Global Standards, Data and Process Insight. To start, I will remind that there is an increasing demand of quality data as the world is approaching the deadline for 2030 SDGs deadline. And the CRVS system that is well functioning provide data for monitoring about 70% of all SDGs and about 40% of their targets. The Rwanda CRVS system have had an improvement since 2016, and that was due to the digitalization, the decentralization of CRVS system, the process review, and the strong coordination of stakeholders that led Rwanda to increasing the birth registration up to 90% of all expected birth. However, many African countries' CRVS system miss key variables, limiting the quality and completeness, and not allowing the production of statistics necessary for monitoring SDGs. This study was conducted to make sure to assess whether the Rwanda birth registration system is correcting all core variables and whether it is following the globally recommended standards, so that we may not let anyone behind, but also not let any variable uncorrected. To assess this, the United Nations Principles and Recommendations for Vital Statistics System document, the 3rd version, was reviewed to identify necessary variables to be corrected for the registration of a newborn, and to identify the standards with which those variables have to be corrected. Those identified variables were mapped with the variables that are now currently corrected in the birth registration system of Rwanda. That was to assess the variable, to assess the process. The Rwanda birth registration SOP was reviewed to identify whether the process is being conducted as recommended by existing global standards. It is important to highlight that among the UN recommended variables, there are variables that have to be directly corrected. For example, the name of the mother, the date of birth of the mother, the date of birth of the child. Those are variables that are directly corrected that you cannot find anywhere apart from asking to the persons involved in the event registration. Of course, there are the derived variables that can be immediately calculated using the existing data. For example, the age of the mother and the place of residence classification in urban and rural. Once you know the place of residence of someone, you can classify it as urban or rural depending on the existing data. Of course, there are some other additional variables like the economic status of the mother and other variables that can be corrected during the registration of a newborn. From the variable matching exercise, it has been identified that about 80% of all core variables recommended by the United Nations are corrected, and it was found that due to the system interoperability, it were some variables that the UN consider as direct variables are in Rwanda are corrected as are immediately derived. For example, for Rwanda, because of the integration, once you put the national ID of the mother, immediately the name of the mother, the date of birth, the age, and the place of residence are immediately populated in the system, making it easier to reduce the typing errors and not having some typing errors and other potential errors. Of course, there are some variables that have been identified not to be corrected, and that will be recommended that they will be corrected. There is a variable that I propose that should be on the list of variables that are core for to be corrected by every nation, and the variable is the child height. That is not among the variable recommended by the United Nations. Once it comes to the assessment of the compliance with the data correction standards, all variables that are corrected were found to be corrected with the recommended standards. By the standards, we want to mean the format in which variables have to be corrected, and it was found that all variables are corrected according to the standards. The process review identified that the birth registration system in Rwanda is centralized, fully digital, and interoperable, enabling the provision of unique identifier for the newborn at the registration. Another finding is that while the global standards recommend that the certificate, the birth registration certificate, should be provided for free, in Rwanda, a birth certificate is provided upon provision of a fee. This part of also the findings. The key enabler of the system, the strength of the system is the system interoperability, enabling the automation and reducing reporting errors. This also allowed the high level of compliance among variables collected and support the production of internationally comparable vital statistics. And another is that uncorrected variables can be got from the interoperability of systems with the DPI ecosystem. As recommendation, policymaker may consider waiving a fee for the first vital record certificate. The uncorrected variables should be corrected, and Rwanda should continue to expand and institutionalize the interoperability of system. Last but not least, the investment in research, public awareness, and system governance would be key to the improvement of the system. Let me thank the organizers of the CAT program and funders, especially 2025 CAT program, my supervisors and mentors, the Rwanda CRVS technical team that work tirelessly to improve the CRVS system, and all civil registrars in Rwanda that are performing a good job. Thank you very much for your attention.
Thank you very much, Valence. So I'll open up the floor for the Q&A for all the speakers. So we'll take about 5 questions first, and then we'll let the speakers respond before we move to the next phase. So by a show of hands, yes, okay.
Ok, merci bien. Ma question est adressée au dernier intervenant, celui du Rwanda. Alors, il a évoqué
for Rwanda. We talk about cost to the registration of birth. I want to know, what is the cost to deliver the birth registration in Rwanda? The cost, as we know, as we've heard in his recommendation, there are some constraints here to deliver the birth registration. So do you have any idea about the cost? Or is there many factors that imply the cost, or is it an official cost? Thank you.
Pour clarifier,
to clarify, thank you. The cost. To have this birth certificate, and we're talking about around $1. In Rwanda, we have invested a lot to deliver services to people, but $1, it's we have to have this cost to get this service. Thank you.
Thank you for your presentation. I forgot the name.
Valence.
Yeah. There was a mentioning on, I'm not sure, the second slide about the recommendations. The first recommendation stating about for policy to waive them. Policymakers may consider waiving fee for first vital record. And does that mean the meaning they're getting your death certificate or birth certificate, or when registering? Is it about, when the fee, waiving the fee, is it for when a person apply to have a certificate for birth or death certificate?
Merci.
Thank you. Questions for all the panelists. First of all, about Zambia. I want to know, concerning the management of information, we're talking about variables, about location of death. We're talking about different variables. Perhaps it's not that relevant for when we talk about health policies. People who live in a village, in a rural area, may die in a city. Is it possible to have more information about place where people die? That's perhaps where there must be some problems, epidemics or others. The second question concern the choice of these presenters of we're talking about system users. We're talking about users of the system, right? So we're talking about the management of, I'm not sure about the translation of this particular term. We're talking about systems user. We're talking about people who benefit from the service. And what is the method here? What is the sampling to get these 300 plus person? And I can see this is very low. So do you have? I think this is very low. About Indonesia. We're talking about matching between this data, system data, and the last speaker who said that about the system that are in place and the interoperability. We have to see the mother, ask her name, her birth date, her birthplace. And when we have doing the ID where the birth is located, perhaps certain things have changed because we're talking about facts, events that are related to the birth, which may have changed in the meantime. So how do you enter this into the analysis?
Thank you. I think we now have 5 questions. I'll let Valence, you start. You have one question from behind on the policy, the recommendation, and then the last one from Paul on the interoperability of the system. So, Valence.
Merci beaucoup.
Thank you very much. I'm going to talk first about Paul's question. I said about interoperability, we can have certain variables, but before writing them down, what I said was, for example, I talked about the name, the birth date, but and also the place of living and not the place of residence. I made a slight confusion here. Talking about the residence and not the domicile. So I think that's a small confusion here.
The process is done. Once a birth is actually, the registration is a process that starts from notification to the certification. And that process, if you miss one of those, the registration is found incomplete, or there is something that there is a problem that is there. For the case of Rwanda, there is no cause for registration. The system have been decentralized to lower levels of registration, but even the certificates are provided online, but for getting the birth registration certificate, you have to pay a fee of about $1 to correct that certificate. With all those investments that have been done until until putting the certificate online, there have been many investments. What we recommend is that that small fee be waived so that the whole process be free without any interruption. Thank you.
Thank you, Valence. And then we'll go to Zambia on the issue of the variables. I hope you got the question clearly.
Yes, thank you so much for that question. Really, the observation and the question is well noted. As you can imagine, looking at the number of variables contained in the verbal autopsy questionnaire, there are so many. And one of the challenges that we had is choosing which variables can we display in a compact way, because we don't want, again, to make the bulletin too long that someone can get lost in it. But then also we want to ensure that we are able to package the information in such a way that a policymaker can quickly make reference to it and then get that additional information. Of course, there will always be an avenue to actually get more in-depth information through other areas. But the bulletins, the strategy is really to quickly have a way of providing those provisional mortality, cause of death statistics. Actually, even with the approach that we intend to use as we assess acceptability among stakeholders, we are not just asking it in a binary form, is this intervention acceptable, yes or no? But we're actually asking them in a structured way to comment on the different areas that they may find the bulletin useful or not useful. Additionally to that, we're also expecting feedback from the different stakeholders on what variables they would like to put in to actually see in this bulletin. So the process is iterative. We anticipate we'll get a lot more feedback that will go into choosing the final variables that will then make its way into the final version of the bulletin.
And then we have a question for Indonesia on the matching systems data. The question, Paul?
Used to select the users, the system users.
Oh, no, that one was for Sri Lanka. You asked Indonesia on when they're looking at the validity, that's the matching of the census and survey data with the admin data. Yeah, I think it was something around that, yeah. How they matched the system data.
Yeah, thank you for the question. So our process is first we check whether our identity, our identity from respondent is valid or not. And then after that, because we can identify date of birth and gender of person by their identity, by their number identity, and then we can check the consistency of that number with answer from respondent. Indeed, they can change gender after they have ID. But for a date of birth, they cannot change date of birth, right? Because, we born just once in life. So first we check whether the ID is valid or not. I mean, it is registered in Ministry of Home Affairs or not. And then afterward, we check the consistency for other variable like date of birth and gender. Is that answer your question? Yeah, thank you.
We go to Sri Lanka on the choice of system users.
Yes.
Yeah.
Yes, thank you for the question, and thank you for asking the clarification about it. Actually, that what I meant by the system users is, I know that system users, by me saying system users, you can say that if the whole population can benefit from the system. What I meant in here is that system users means the data entry operators, because there are 331 divisions in Sri Lanka divided, and the data entry for the system, each division is done by in each division by the specific division, the data entry operator at this division. So there are altogether in Sri Lanka, there are 381 who will be covering the 331 divisional secretariat officers in Sri Lanka. So out of that sample, those 300 odd people were taken as the system users because they use the system every day to enter the data, and then they enter the data into the central database. I think I answered the question, right? Okay, thanks.
Thank you very much. So I'll go to Tanzania, then there's Lesotho. Okay, Richard. Then one last person for the this phase, and Kofu. Okay, that's fine.
Thank you. My question goes to Varen. It was partly answered, because I was wondering, from the first graph, it showed that the completeness is very high, it is over 90. And you mentioned that there is fee, but you have already explained how the process is done. But what is the action in the ground? Do people register and correct by paying that fee, or they just register and leave the certificate without collecting the certificate? Thank you.
Thank you, Scholar, and congrats, Valence, for your nice presentation. I would like to know, in one of the recommendations, you say you are advocating to include some missing variable in the system. So can you please clarify? Would like to learn from you. Maybe I missed that one.
Merci. Je voulais poser ma question.
Thank you very much. I wanted to ask a question for the Rwanda presentator. We mentioned the cost. And I'd like to have a better understanding the situation of cost. When I'm looking the rate of birth certification, it's above 80%. And for the deaths, it's more than 50%. If I compare to Africa, what about the cost? The cost is for the walk from the house to the health center, or when you mention this notion of cost, what kind of cost are we talking exactly about? Thank you.
All the questions are for Rwanda. So, Valence.
Okay. Let me start by providing a clear meaning of the cost that I was talking about to be waived. There is no, during the registration, there is no cost that is there. Nothing has to be paid for someone to be registered. In addition, service have been moved to the lowest levels of administration, allowing people to access the registration. And all events are registered at the point to where they occur. For example, if a birth occurs at health facility, it is registered at the same health facility. So there is no cost, there is no additional transport cost that is there. Now, if a child is registered until the point of certification, the certificate is available on the online platform. So at that point, a birth is already registered. But one part that is missing is at the point of correcting the birth certificate, there is that fee that is paid on the online platform to get that paper. What we want is that the paper, the fees for correcting that paper may be waived. So the registration is already done. The certificate is available in the system. You can access. The unique identifier is provided to the child. You can go for other services like vaccination with that unique identifier. But once it comes to correcting a paper, you have to pay that fee. During the registration, what we do, during the analysis, we correct or registered birth, irrespective of those who went to take the paper, and we analyze those. The process is finished, but the correcting a paper is what requires that fee. And the experience on the field is that not all registration get the certificate. They go without certificate while the registration was complete. Those who get certificate are the ones who are in need. And what we need is that that fee may be waived so that you get registered and immediately you get the certificate and you go with it. This is what I think I responded to the questions from both of you, and yours is about missing variables. Okay. Okay. Actually, the review of the recommended variables identified 34 variables that are considered as core by United Nations. Among them, there are some variables that are not corrected in the CRVS system, mainly the duration, the date of birth of the last born, and the date of marriage of the mother, and another variable is about the duration of residence of the mother, the duration at the point of residence of the mother. Those are variables that in the discussion were found that we can access them through the interoperability of existing systems. And what we recommend is that they be added on the list of variables to be incorporated in the CRVS system. It is a list of 7 that are available in the paper that is in progress, and the list can be shared so that if you are interested, you can get the list. But in few, they are those ones that I come to talk about. Thank you. Except if there is any clarification that is required.
Yeah. Thank you, Valence. And speaking on your presentations and the questions that are coming out, this fragmentation when it comes to registration, because a birth is first notified before registered, before certified. So when you're talking about birth registration, at what point do we say that that birth is fully registered? So that's where now we are having so many, a bit of confusion, let's to say, that I was given a notification slip, but I've not filled for the certificate. So is that birth registered or not? So the fragmentation of the systems in the CR, maybe we can for once have a solution. Once a birth occurs, you just leave the hospital with a birth certificate and we say that birth is registered. Any other question? Yes, Beatrix. Anyone else before? Okay.
I have two questions for the two presenters from Indonesia. My first question for Sandy, I don't have an IT background. Can you describe what latency and throughput are and sort of why they matter and if there might be any variability depending on like network connectivity across Indonesia? And then my second question is for Winnie. You mentioned that there is a bit of a window of opportunity right now in terms of government making new policy decisions on census and CRVS. And I'm just wondering if you've had the opportunity to talk to any government officials or policymakers, and if not, do you still have a sense of whether they might be open to changing towards the system more similar to what you're proposing with your costing analysis? Thank you.
Okay, thank you for the question. I cannot explain this all in my presentation because time limitation. So latency is how fast one request can get back to the requester. So if field enumerator call service to our web service, and then they get back the return, it is like latency, how fast it is. And for the throughput is how many requests that served by server in 1 second. So it is like if that can serve big throughput, it means it can be scalable. It means it can be served for amount of users, something like that. Thank you.
Thank you, B, for the question. So you're asking whether how we propose this cost financing, whether we have mandate or no. So I would give the information. So the new regulation has to or must to be enacted this year. So that's very good, strong foundation because before the new regulation, interoperability is not mandated. It's most likely like initiative of the regional, initiative of some institution. So it's not scalable at national level. But once we have mandated in the new regulations, so all the stakeholders, all the key partners has to do or has running or has to make sure that interoperability is in place after the new regulation. So that's what strategy that our CRVS team Indonesia to make sure that what our vision, our ambition on the CRVS is will be running, implemented with the whole idea, the good things that always discuss, the finding and so on. So that's why we postpone the vital statistic report because it's sometimes kind of like obstacle. So, like I mentioned in the presentation, one is just evaluation, just findings without sharing agreement, sharing vision across institutions. It's hard to make sure, or you have to move towards some things that we want to achieve in the 2030. So that's the first thing we do. So, like I said, it will have to be enacted in this years. And then that's why we now trying to propose what the cost of the strengthening CRVS. That's the idea first. At least every stakeholder buy in the idea, by the regulation, and then by the time, this is only the beginning of the cost financial, maybe there will be any other proposal, not only from BPS, maybe from academia, or maybe from MOHA itself, or from Ministry of Planning. It's open discussions. At least we're trying to open discuss after the regulation. We can propose finance funding to the Ministry of Finance. Thank you.
Anyone I'm looking at? Okay. So in summary, just a 1 minute pitch to now our audience. We've looked at the various ways in which the statistical process can be strengthened. The first presenter talked about the cost implication, how the proposed, and we know now in the current funding space, when you mention to someone 3.1 trillion, and I hope it's not USD, over a period of time, it needs money, it needs investment to achieve where we are now. To Stephen talking about alternative, just complementing already what is being produced, just to have more information out there. Then we had Maya talking about now the evaluation of these systems that are already in place. So we have systems, but are they really working for us? Are they producing what we need? Are the people aware? Have we put the correct infrastructure just to have the whole statistical process in place? Then we had Ignatius saying, guys, you've collected all this information. How valid is it? When you look at the different sources, you have admin data, you have censuses and survey. Are they all talking to each other? Are we talking about the right definition of variables? At this, when I talk about TFR from the admin data, is it comparable to what is coming out from the census and the surveys? So all this is just the statistical process that is being what? Strengthened. And then we had a very good presentation from Rwanda. And Rwanda is one of the African countries that they are there. Let me say that when it comes to reporting the SDG 16.9, they're there. But then Valence is asking, yes, the birth registration is 90.3. I know marriage and death registration in Rwanda is also high. But are we reporting all the variables that the UN recommends? We might be doing the registration, but is it following with all the variables that are required, both the core and the non-core? So to my speakers, just 1 minute, don't worry, we have time. So you can take 1 minute, 5 seconds extra. I want us just to give our final experience or final thoughts on what do you think the leadership, our different government leadership should play in sustaining all these beautiful ideas that we are coming up when it comes to improvement of the statistical production process and the civil registration as a whole. So I'll start with Maya, then go to Stephen, then Valence, and then Indonesia will close. I don't know if both of you want to talk. You can consult and give us just from one point of government leadership in Indonesia. What do you think they should, what is their role in sustaining the CR improvement? Thank you.
Thank you. I think you are up to a good end of the session. So actually, good governance, CRVS needs good governance always. With a good governance, without good governance and proper planning, we can't get sustainable systems to be functioned, and we need to make a good basis with the good government collaboration, interministerial collaboration, good governance, good planning, and then plan on and also the funding factor. So with all these, I think we can have sustainable systems in the future. Thank you.
Let me start off by agreeing with the governance. I think governance is really the beginning point in everything. And the next important step for me would be systems interoperability. I think even as we see the low death registration rates in most African countries, the reality on the ground is that there are systems in place which actually do collect this information. The challenge that is there is, can we bring this information together? Then can this information be brought together in such a way that it can be analyzed to generate a picture for the whole? So on top of governance, I think government should also focus on strategies to increase interoperability. And I think the use of information technology systems is key going forward.
Okay, thank you. The first foundation is to understand the CRVS as not only for the vital statistic production, but also for service delivery. Having a citizen-centered leadership enabling to provide a service to all citizens is the key and the foundation of the strengthening of the CRVS system. Thank you.
Thank you, Skorsika, for the very nice question. So, what I'd like to emphasize that CRVS is not a technical issue. It's also about coordinations, commitment, and making the system work as a whole. So it's governance. So leadership in CRVS in Indonesia, I would say, is multi-institutional. So different institutions have clear roles. Ministry of Home Affairs leads with disease registration. Ministry of Health is responsible for health-related data. And BPS, Statistics Indonesia, can play a key role in producing official statistics. So this is kind of something unique in Indonesia. The next regulation for vital statistics and also coordination with civil regulation will be led by BPS, but it doesn't matter who leads in Indonesia. The one thing that we have to make sure is everything is very clear in the new regulations. That's one thing that everyone we can collaborate together. So, and in the new regulations, we have to make clear that we have a shared agreement, shared leadership with clear mandates. So that's for me.
Yeah. Thank you very much. That's a very good way of summarizing the session. But one thing we know, once we have our data outside there, we want to see how to encourage the users to make use of this. What policies are coming out of it? There are several papers out there. If you just go search the economic implication or importance of CRVS data into the different government, there are very nice papers that have been written. But looking at, it's good that 95% of us are from government. So we are the government leadership out here. So it starts with even our own administrative efficiencies on how we are going to churn out our operations, just to ensure not all the time we need donor funding. It starts with how efficient is our administration processes. So I think I'm not closing anyone out. We still have time to interact more and ask each other more about the operations within our country. And I want to say thank you very much, Asante Sana, Zikomo, to everyone who attended our session. And let's keep these conversations going on. And I want to thank my wonderful presenters for the beautiful presentations and discussions that we've just had. And enjoy the closing session and the interaction session. Thank you very much. And please take photos of the last session. This is the last and the best.